We recorded 5,231 local infections as of yesterday, including 1,315 PCR positive cases and 3,916 RAT positive cases. We also recorded 156 imported cases, including 142 PCR positive cases and 14 RAT positive cases. And among the 156 imported cases, 49 were picked up at the airport, and 64 were picked up in quarantine hotels or quarantine centers. 38 cases belong to specimens collected between day 4 and day 7, and also 5 more cases belong to specimens collected between day 8 and 10. And these imported cases come from 38 countries, and 5 imported more than 10 cases, including 24 from the UK and 22 from the US and 14 from Thailand and the Philippines. And also for 33 other countries, they have imported fewer than 10 cases. We've also received 12 death reports, and as of today, in the fifth wave, we have recorded altogether 9,733 death cases. As for care homes, today there are 6 residential care homes reporting 8 confirmed cases to us involving residents, and 25 other residents will be subject to quarantine. As for schools, there are 391 schools reporting 552 positive cases to us, affecting 471 students and 81 teaching staff. They are from 90 kindergartens, childcare centers, 156 primary schools, 138 secondary schools, and 7 special schools. 264 schools reported more than 2 cases to us in the past 7 days. We have advised 13 classes belonging to 12 schools to be suspended for a week as of yesterday and today. That includes 5 kindergartens, 1 primary school, 4 secondary schools, and 2 special schools. As for subvariants, for specimens collected on the 20th of September, 86.6% belong to L452R. So for BA.5, the percentage is 79.9%, BA.4 6.6%, and then BA.2 12.1, some 2.6%, and then BA.2.2 6.9%. The floor is open, and if you wish to ask questions, please use the mic and introduce the media organization you represent. I'm from Now TV. The government just announced relaxing requirements for arrivals, and inbound travelers can leave the airport without having to wait at the airport for the test result, and they can also take public transport to the hotels. Are you worried that this will increase transmission risk? Do you expect the caseload to increase substantially? And about the nosocomial infection in Medical Center yesterday, have you identified new cases? I think that the other side is still holding this press conference, and the secretary already explained the relevant requirements for arrivals, so I shall not repeat. About the cluster we mentioned yesterday in CMC, we have not identified other cases. One more question. I'm from Ming Pao. Dr. Ho Pak Leung described this morning that it would be safe to even introduce 0+0 requirement. And what is the CHP's view on this proposal? And the secretary just now mentioned that there are 3% of all arrivals testing positive. So there is a certain risk. What is the CHP's assessment of the risk entailed if we allow the 3% to enter our community? And about the prerequisites for returning to more normalcy, Secretary once mentioned that we should resume 80% of capacity of the healthcare system. Have we reached that target? And if it falls below 80% of capacity of the healthcare system, will the government consider tightening the measures? And what is the definition of returning to normalcy? And about the requirements for arrivals, I think the chief executive and the secretary are explaining the situation. You can refer to that press conference. Now, on demand for healthcare services. In the past week, we have reviewed the data and we have identified the downward trend. And as mentioned by the chief executive, we have just resumed the second phase of our hospital bed mobilization plan. And there are patients who are not COVID patients but have healthcare needs. We can start providing non-essential services to them, such as general outpatient clinics. They will be resumed in phases. As for a rapid about turn of the epidemic situation, of course, we keep our plan flexible. In terms of hardware, manpower, we do keep in view the epidemic situation. If there are no other questions, one supplementary.
I'm from Mingpo. Is it that we can now resume? We're going back to 80% of our, medical service, level. Dr. Albert said that after the fifth wave, we may not be able to have zero COVID. But he didn't say by how much will the number of cases drop before we will go back to normal. So for Hong Kong, by how much will the number of confirmed cases drop before we say that we are, going back to normal and that the epidemic is under control? I think the epidemic is now, beginning to drop since it's reached its peak. But I don't think we can give a figure as to by how much the figure will drop before we're going back to normal. So we're still, setting the target of resuming our medical services up to 80%. But of course, we can't do that overnight. For many days, we have been working towards that direction. I think that's the end of the briefing. Thank you very much for coming.